My name's Peter May. I'm a physiotherapist and I specialise in musculoskeletal patients. I work at the Royal London Hospital. I do a 50% clinical role and I also do 50% of my time in orthopaedic research. So that's working on large-scale trauma trials, both setting them up, delivering them and also coming to the results. So that involves working with a lot of different clinicians, which is really interesting. So a lot of work with surgeons, a lot of work with universities in order to make these large-scale trials happen. I recently started the Clinical Entrepreneurship Programme, which is something that brings together like-minded people who are interested in starting up healthcare businesses. It's run by NHS England and is the first year that allied health professionals can be involved. Running a business has always been at the back of my mind. I come from quite an entrepreneurial family and I think that's just rubbed off on me. The idea that I've come up with is born out of interests that have spread throughout my career really, and I think wanting to make an impact on a larger scale through public health essentially, and I've been doing some public health modules at King's College, and through that I realised that there was a real gap between exercise and exercise prescription in the community, and that was what brought me to the idea of building something where facilities were more available, as well as in my clinical career really, where I've noticed that often there's a bit of a drop off and a cliff where patients are sent out into the world without anywhere to go essentially in terms of where to do the exercises that I give them. And so that was where the idea came from. The programme lasts for between 1 and 2 years, and the idea is that by the end of it you'll come out with a new business which will bring benefits to patients. And through the programme I hope to raise funds through approaching venture capitalists, as well as utilising all the new skills that I'm going to learn around the legalities of starting a business, how to create a business ethos. And I'd like to take that forward into developing a company that I feel will benefit patients, the NHS and hopefully me as well. I hope that it doesn't take me completely away from clinical practice, but I'm enough behind it that I know that it may well do if it's very successful, and I'm happy to take that path. Either one I'm happy with really. It's a fantastic time to be an AHP, and the reason for that is because it's a time of real disruption, and through disruption comes opportunity, an opportunity to build a career that suits your personality. By becoming a multilinguist in healthcare, so I mean that by taking opportunities towards public health, towards starting new business. I've also taken opportunities to learn about leadership on the NHS leadership programme. Through all those different avenues, new things become available to you, new opportunities, new doors open, you meet new people who want to take you in all sorts of directions. The future looks exciting because I have so many different avenues that I can go down for my career, and who knows where they'll lead. Hopefully into a new business or into some sort of far-reaching role in the NHS, who knows.